So how long should a female start taking PrEP? If this is a conversation that she's having with her partner and they want to go down this path, is there a right time to start that's better than, say, do I do it a week before, a month before? How long is typically advised?
Yes. And so for the medication that's taken by mouth to get to the appropriate drug levels to provide protection, you need at least, the science says, you need at least 21 days to get appropriate drug levels. What I tell people is start the month before, right? So you have your cycle, start your PrEP, and then, have a month pass and then try and have fun trying.
Very important to have fun trying. What about side effects? Because a lot of people talk about, oh, I don't want to put another drug in my system. Let's talk specifically from a female perspective and a female who is wanting to get pregnant. What are the potential side effects?
So the side effects are few and they are rare. The most common thing that happens with people who take PrEP is that they have weight loss without trying. And for most women in America, they would say, hey, maybe that's a good thing.
That's not such a bad thing.
Yeah, exactly. And so some people can have some stomach upset as well. Now, if someone has other medical problems, that can make it a little more complicated. So if I want to get on PrEP and I already have another medical problem that causes damage to my kidneys, for example, PrEP does put pressure on the kidneys as well. And so in the setting of having not totally normal kidneys, that might be a problem for the woman. And the other thing to think about is that in the long term, PrEP can cause decreases in what we call bone mineral density. So how dense or how, hard and strong your bones are, which is something to think about for women, because as women age and get outside of that time of your life where you're having babies and you get into that postmenopausal stage, their bones tend to thin anyway, and they tend to be at risk for osteoporosis. And so it's important to just think about, well, is there anything else that could be driving thin bones for this woman as I'm thinking about PrEP as a long-term solution? Now, just because you've decided to take PrEP as part of the I'm trying to make a baby experience doesn't mean that you have to use it forever. And so that is also a way for you to decrease or mitigate risk.
If you want more information about what we've talked about today, go to the website, pluslifemedia.com. And you can always follow us on social media. We are at PlusLifeMedia. Until next time, take care. See ya.